All right, so we are here with Jason today. Jason, tell us what brings you in.
What brings me in is I'm having some lower back pain primarily, a stomach sleeper. So hopefully I can get that adjusted and get better sleep at night. Also, I'm having some neck pain that gives me a couple headaches. I have seasonal migraines that I'm starting to get now as the springtime's rolling around. So hopefully the doctor will be able to help me out with that.
Okay. And you injured yourself running track a couple years ago?
I did, and that was my first experience with a chiropractor. I had a great experience, but that was about 7 years ago. So I'm hoping that it's like the first. I have a great outcome.
Okay, so let's go ahead and we're going to check her spine and see if we can see where some of the areas that are causing dysfunction are coming from. All right, so we're going to look all the way down. All the way up. So we're checking her ranges of motion and flexion and extension. And then we're going to check in rotation, turn all the way to the right. Little restriction there down at C5, C6, all the way to the left. And then you can feel her atlas and axis are also restricted at the top of her cervical spine. Let's go laterally. And you really have some built up muscles at the top of your back. Is this from when you did athletics growing up?
Yes, definitely.
Okay. Let's see, we're going to cross both arms. Good. Now we're going to check some of the ranges of motion in her lumbar spine. Can you lean all the way forward? So check flexion, come all the way back into extension. And as she comes back into extension, I'm going to stress the facet joints in her lumbar spine and see if we can reproduce some of the pain. So lean all the way back. Does this hurt?
Definitely right there.
Let's twist. Good. Any pain here?
Slight.
Any pain here?
Yes.
Come back to the front. Just check one more thing. Does this hurt?
Not painful.
Not much. Okay. And let's see. We're going to lay face down and we're going to check her sacroiliac joints. And can you lay face down here? Good. So now we're going to go through several orthopedic tests on her lumbar spine, her sacroiliac joints, and see if any of these are positive. So this is the Hibbs test. Any pain here?
No.
No. We'll go into a Yeoman's test. Any pain here?
A little bit.
A little bit. We'll check the other side. Any pain here?
No.
Yeoman's test. Any pain here? Good. And then we're going to perform an Eli's test. Any back pain here?
Pressure.
Pressure, okay. All right, so let's see. Can you lay face up, please? So we found the areas of the spine where some of the mechanical joint restriction is taking place, and we're going to go into the vertebrae in the neck and restore the mobility. So we're going to isolate the atlas and axis at C1, C2. Feel okay?
Yes. That's great.
Now we're going to get her upper thoracic spine through an anterior spinal adjustment. We'll come down just a little on the table. And from here we're going to cross both arms. Good. Bring this one on top, this one underneath. Good. Now we'll get her lumbar spine and pelvis. Can you lay on her side here, please? Face me. We're gonna bend this top leg out, straighten the bottom leg. We're gonna cross this arm here. So you can really feel here at L3, the facet joints are moderately restricted. We're gonna go right into the left facet. Good. Perfect. And let's lay on the other side. Looks like on the left it's the sacroiliac joint and the sacrum that's causing some of the restriction. Perfect, good. All right, now we're gonna proceed with some electrical muscle stimulation. She just had her chiropractic adjustment, and we're gonna finish off with a little physical therapy on her lower back. So we'll be right back. All right, we've started the electrical muscle stimulation, the spinal decompression therapy. Now we're gonna go in and work on some of her tender nodules and trigger points around her shoulder blades and into her lower back with the hyper ice therapy. Side or the other side? So oftentimes headaches are coming from the vertebrae and muscles in the neck. So it's very important as clinicians that we address some of the musculoskeletal imbalances in the muscles that start in the top of the back and run up to the neck. So we're going to go ahead and do an active release stretch while we perform myofascial therapy on the levator scapula muscles in our patient's upper thoracic spine. So it's been about 7 years since you had a chiropractic treatment. How do you feel?
I feel great.
Yeah, good.
Yeah, definitely.
Well, there you have it, folks. It's a full spine chiropractic adjustment with physical therapies. Once again, it's your Raleigh chiropractor, Dr. Jeffrey Gerdes. Thanks for watching. Until next time.